Section 2. Standards. The Nurse Practitioner Practice Standard outlines the expectations that are unique to NP practice. NPs are also accountable to practice according to other CNO practice documents and relevant laws. The following scenario shows how NPs apply various standards and guidelines to their practice. Joe is an NP at a community clinic. When would he use the following practice standards? The Nurse Practitioner Practice Standard, the Documentation Standard, the Confidentiality and Privacy Personal Health Information Standard, the Consent Guideline. Joe would use the accountabilities that are set out in the Nurse Practitioner Practice Standard when he assesses a client, diagnoses a health condition, and prescribes medication. Joe applies the documentation standard when documenting his assessment findings, diagnosis, and treatment plan. Joe refers to the Confidentiality and Privacy Personal Health Information Standard whenever he shares information about a client's health condition. Joe uses the Consent Guideline if he has questions about getting informed consent from a client for a treatment plan. It is important to note that multiple standards often apply to any given situation. For example, Joe also uses the Therapeutic Nurse-Client Relationship Standard, Professional Standards, and the Ethics and Privacy Standard when doing all of these things. In Ontario, the titles Nurse, Registered Practical Nurse, and Nurse Practitioner are protected by the Nursing Act 1991. This means that CNO has the authority to restrict the use of these titles, and that only members of CNO have the right to use them. Additionally, only registered nurses in the extended class can use the title Registered Nurse in the extended class, Nurse Practitioner, or NP. All NPs have one or more specialty certificates. The specialty certificates are Nurse Practitioner, Primary Health Care, Nurse Practitioner, Pediatrics, and Nurse Practitioner, Adult. The specialty certificates refer to a specific client population. They do not refer to an area of clinical focus, such as cardiology, or a practice sector, such as acute care or home care. NPs may work in any sector or setting, but they can only provide healthcare services to the client population related to their specialty certificate. So an NP with an adult specialty certificate may provide healthcare services to clients who range in age from late adolescence to older adulthood. An NP with a pediatric specialty certificate may provide health services to clients who range in age from neonates to late adolescents. And an NP with a primary healthcare specialty certificate may provide health services to clients of all ages. Employers will determine which specialty certificate is needed for a specific role. Therefore, it is important that NPs discuss with their employers the expectation that they only treat that population. They must also make sure other members of the healthcare team, and if necessary, a client, know and understand that they must limit their practice. It is the NP's responsibility to ensure the client and other members of the healthcare team are aware of their specialty certificate. The following scenario shows how this can be done. Susan is an NP with a pediatric specialty certificate. Susan is about to start a new job in a community sexual health clinic. How can Susan provide clarity on her role within her new team and make sure she limits her practice to a client population consistent with her specialty certificate? Susan meets with her hiring manager before starting her new role and discusses the condition that she not provide health services to adults. This way, the manager has realistic expectations about Susan's practice. Susan's manager assigns Susan to the health unit's adolescent client population. Susan also meets with her new colleagues to discuss her role. To maintain registration in the extended class, NPs must maintain competency in clinical NP practice. This clinical practice must include direct interaction with the client population of the specialty certificate that the NP holds. The clinical practice must also include the use of advanced nursing knowledge and decision-making skill in the health assessment, diagnosis, and therapeutic treatment of those clients. During annual membership renewal, when nurses renew their registration with the college, NPs are asked to declare if they have met the clinical practice requirement within the previous 3 years. If they do not meet this requirement, they are not eligible to remain registered in the extended class and can no longer practice in NP's extended scope of practice. NPs are also expected to demonstrate the NP competencies that apply to their practice. This concludes Section 2.